Hello, I am here to tell y'all about Asperger syndrome. People are probably wondering what Asperger syndrome is. Asperger syndrome is an autism spectrum disorder, and people with it therefore show significant difficulties in social interaction, along with restricted and repetitive patterns of behavior and interest. It differs from other autism spectrum disorders by its relative preservation of linguistic and cognitive development. Although not required for diagnosis, physical clumsiness and atypical use of language are frequently reported. Asperger syndrome is also called Asperger syndrome, Asperger, or Asperger's disorder, or just Asperger's. It is named after the Austrian pediatrician Hans Asperger, who in 1944 described children in his practice who lacked nonverbal communication skills, demonstrated limited empathy with their peers, and were physically clumsy. 50 years later, it was standardized as a diagnosis. But questions about many aspects remain. For example, there is lingering doubt about whether it is distinct from high-functioning autism, also known as HFA, partly because of its prevalence is not firmly established. The exact cause is unknown, although research supports the likelihood of a genetic basis. Brain imaging techniques have not identified a clear common pathology. There is no single treatment, and the effectiveness of particular intervention is supported by only limited data. Intervention is aimed at improving symptoms and function. The mainstay of management is behavioral therapy, focusing on specific deficits to address poor communication skills, obsessive or repetitive routines, and physical clumsiness. Most individuals improve over time, but difficulties with communication, social adjustment, and independent living continue into adulthood. Some researchers and people with Asperger's have advocated a shift in attitudes toward the view that it is a difference rather than a disability that must be treated or cured. Some of the classifications. Asperger's syndrome is one of the autism spectrum disorders, ASD, or pervasive development disorders, PDD, which are a spectrum of psychological conditions that are characterized by abnormalities of social interactions and communications that pervade the individual's functioning in restricted and repetitive interest and behavior. Like other psychological development disorders, ASD begins in infancy or childhood as a steady course without remission or relapse, and has impairments that results from the maturation-related changes in various symptoms of the brain. ASD, in turn, is a subset of the broader autism phenotype, also known as BAP, which describes individuals who may not have ASD but do have autistic-like traits, such as social deficits. Of other four ASD forms, autism is the most similar to AS in signs and likely causes by its diagnosis, requires impaired communication, and allowed delay in cognitive development. Rett syndrome and childhood degenerative disorder share several signs with autism, but may have unrelated causes and pervasive development disorder not otherwise specified, also known as PDD-NOS, is diagnosed when the criteria of more specific disorder are met. The extent of overlap between AS and high-functioning autism, HFA, autism unaccompanied by mental retardation, is unclear. The current ASD classification is to some extent an artifact of how autism was discovered. It may not reflect the true nature of the spectrum. A panel session at a 2008 diagnosis-related autism research planning conference noted problems with the classifications of AS as directed subgroup of ASD. And two of the three breakout groups recommended eliminating AS as a separate diagnosis in future versions of the Diagnostic and Statistical Manual of Mental Disorders and of the International Statistic Classification of Disease and Related Health Problems. Asperger syndrome is also known as Asperger syndrome, AS, Asperger's or Asperger's disorder, AD, or just Asperger. There's little consensus among clinical researchers about whether the condition's name should end in syndrome or disorder. Okay, so in the next video, I will be talking about the characteristics, which are the social interactions, restrictive and repetitive interest and behaviors, speech and language, and other, and also the causes and mechanism, screening, and diagnosis and management and therapies will all be, and medications and prognosis, and will be in the rest of the upcoming videos. Now, where I am getting this information from is Wikipedia, but also that's the place I'm citing it from. I'm also have knowledge of this being diagnosed with Asperger's, so I'm going to be using a couple of different references throughout the rest of these videos. So, thank you for turning in. Again, the next video will be about the characteristics and classifications. Thank you.